everyone, I'm going to come down here. I'm Sally and we are at Xodos at Astonwood Golf Club, and we are going to do a live laser hair removal session for Emma on her underarms. You may have seen us do one recently for her face and neck, and we're going to do a little review on that as well. So what have you noticed since that? Because that was about 2 weeks ago now, wasn't it?
Yeah, reduction in hair growth was really surprising.
Can I have a look?
Of course.
So you may remember from before, it was the worst part for Emma was this bit down here. Now there's a few little ones there. Oh, there we go. Okay, so one of the things we noticed, I'm sorry that you've only got my head and shoulders. One of the things you notice is the hairs that are treated will then slide out of the hair follicles. Now you probably can't see on that camera. We've got a hair that is literally, did you feel me pull that out? So we're not plucking them, they literally slide out. That one isn't ready yet. So we're just at that point. Emma's going to start noticing those hairs starting to slide out, and there you go, there's another one that's just come out, which is brilliant. So those hairs will slide out, and Emma will get a week or two now with no hair there, and then we'll treat again in another sort of probably first thing in the new year and keep those cycles going. I'm going to move the camera back a bit because otherwise you're only going to see me from the neck down, but actually it's more important that you see Emma anyway. So I'm just going to move this back a bit. That's probably a little bit better. Okay. Hi, Charlotte. Okay, so the first thing we're going to do is prep. We've actually wiped and cleaned under Emma's arm because some deodorants react with the gel and things like that. Obviously we've done full consultation and we know that nothing's changed medically with Emma before we've started. And so we're now ready to proceed. So if I can get you to lift one arm up for me. Okay, so it's freshly shaved, and that's the beauty of laser hair removal. You don't have to let any hair grow. You can shave as often as you need to, and you always shave within 12 to 24 hours of a treatment, so that the skin is nice and smooth. We only want to heat up the hairs that are sitting in the hair follicle, and because that's where you're going to get the response. If we have longer hair, it will just heat the hair up on the surface of the skin, and we don't want to do that. So we use a water-based gel. It's a bit like a thick ultrasound gel. And if you're not sure what to expect with laser hair removal, this one doesn't hurt. And the reason it doesn't hurt is because Emma is going to tell me if it starts to get too warm or if it feels prickly. Okay? So similar to how we did with the face treatment, anything more than comfortably warm, just say stop. Okay? So you might not be able to hear too much over the beeping. Feel that? That's nice and cold.
Yeah.
Okay, so she's going to know about that. The tip of this is actively chilled, so we keep the surface of the skin cold. So cold, chill the skin first, and then when we start, if it feels more than comfortably warm or if it feels prickly, just say stop. I got a comment recently doing this that somebody was concerned that I was going over and over the same area. The way the Soprano Ice works means that it's a gradual build-up of energy. With other types of laser, you're literally zapping one. Oh, that one's actually. You're literally zapping individually. That's not necessary with this. We gradually build up that energy, which is the main reason that it's pain-free. It really doesn't need to be painful at all. So if we keep that movement quite quick, I won't zap you. This is brilliant if you get recurrent ingrowing hairs, shaving rashes, and that dark shadow that you get within a very short time with a lot of people, or even immediately after shaving, a lot of people have still got a dark shadow. That will eventually go away because there are no dark hairs sitting in those hair follicles anymore. What people tend to find is as they go through a course of treatment, the hairs that come back finer, fairer and softer. So that's one full treatment on that underarm. Now we're going to turn Emma around so we can do the other side. I might have to move the camera, so bear with me. And again, when we revisit to do Emma's face in a couple of weeks, we'll have a look at this because that's the point that these will be starting to fall out. Does that feel dry enough? Is that okay? So I'm going to turn you around a bit. You want me to roll out? Okay, so I'm going to come round. just going to turn that back that way a smidge. Okay. If you want to lift this side up for me. So again, exactly the same. Was that temperature-wise, was that okay? Apart from the one time that I gave you a little zap. The reason we have the all virtually pain-free caveat is because occasionally you get a little zap. Obviously we're off demonstrating, it got a little bit warm. So, so long as the client is telling me all the time that it's okay or it's not getting too warm, then it doesn't need to be painful at all. People worry that if it's not hurting, it's not doing anything. That's really not the case. It doesn't need to hurt at all, and it will still be effective. As we can see from these hairs on Emma's throat, they are starting to fall out. The treatment has been effective. Okay, so cold start. It's nice gentle movement across the skin. Those hair follicles under the skin there are heating up nicely, and that is designed to destroy the little growth mechanism and the tiny bit of blood supply that those hairs get. Obviously the hair is still in the hair follicle, we're not physically removing it like waxing, which is why it takes a couple of weeks for them to fall out. And all of the hairs will fall out. Not all of the hair follicles will be permanently destroyed, but all of the hairs themselves will be destroyed and fall out. And the ones that are in active growth phase, which is around 15 to 20% of each hair cycle, will permanently be destroyed with each treatment. And that's why you need a course of laser hair removal, because with each treatment you remove another hair cycle. And you are damaging the other ones, the ones that aren't in active growth phase. There's sometimes enough pigment in those hair shafts to cause some damage to make the hairs that come through softer and finer. So that literally is it. It's that quick. That is a full treatment on underarms. All of our patch tests are free, subject to a deposit. An underarm treatment costs £85, or a course of 8 for £550. So you pay for around 6.5. A lot of places will only do courses of 6. 8 treatments give around a 70 to 80% permanent reduction. I'm conscious that you can see in the top of my head. So 8 treatments really is the way to do. So that's a kind of minimum. We do top up blocks as well, but even with 8, Emma's going to get a really, really good result with this. So I'm going to finish up here for now. Any questions, just message me at the bottom, and we will see you in a couple of weeks with the results of that and the next treatment for Emma's face. So have a lovely Christmas. See you soon.